We are now seeing emerging research that shows both uterine fibroids and vascular disease share inflammatory pathways.
These are benign tumors. They're not going to kill you. And then these other symptoms that you deal with, heavy bleeding, pelvic pain, well, that's just, you just live with those. Most of the pathology and most of the symptoms are related to the blood vessel side. So what we focus on is we kind of, we're looking at a fibroid like it's a vascular issue.
This is the Transformational Life Consulting Podcast with Deepa Grandin, MD, where Christians like you get the practical support and tools you need to build your spiritual, mental, and physical well-being, and to guide you on your journey to health and wholeness based on evidence-based science and God's Word. I am your host, Dr. Deepa Grandin. Welcome to the Time to Transform podcast. I like to extend a special welcome, especially to our new listeners. We are so glad you've joined our community. Our goal is to bridge the gap between cutting-edge medical science and practical lifestyle changes that focus on your spiritual, mental, and physical wellness. So, whether you're here to take control of a specific diagnosis or simply to optimize your long-term vitality, I hope the insights shared today empower you on your journey to transformation. So today's topic is I know I say this a lot, but it's truly near and dear to my heart because of the many, many women that struggle with it. It's a topic that affects close to 80% of women by age 50, and yet it's not discussed very openly. It's usually behind closed doors. And that is uterine fibroids. So for a long time, the medical community viewed fibroids as an isolated gynecological problem. Nuances, you just watch or surgically remove it. But as we move through 2026, the narrative is shifting dramatically. Thanks to the advocacy of celebrities like Venus Williams, public awareness of this condition is growing tremendously. So we are beginning to understand that these growths are not just local tissue problems. Instead, they are powerful systemic health signals. You can even consider them like canaries in the coal mine for a woman's entire vascular and metabolic system. So joining us today is Dr. Kevin Lee. He's the head of vascular and interventional radiology at Georgia Endovascular. And Dr. Lee is at the forefront of this shift. He helps people view the body not as a collection of separate organs, but as an interconnected highway of vessels and signals. But before I bring Dr. Lee on, I want to focus on some facts that are changing how we treat uterine fibroids. So the latest research shows that our daily choices do more than just manage symptoms, right? And that's something you guys who have listened to me in the past have heard me say repeatedly about intentional living and the impact of lifestyle on a biological environment. And now we even understand that this biological environment where fibroids thrive or shrink can be dictated by our lifestyle choices. So a landmark 10-year study recently revealed that women with fibroids have an 81% higher risk of developing heart disease. And for women under the age of 40, the risk actually surges to 251%, which is insane. So this tells us that inflammation driving fibroids is often the same inflammation that's damaging our arteries. We've also seen that sedentary behavior, it's a major fuel source for these tumors. So for instance, spending 6 or more hours a day sitting can double the risk of fibroids, likely because it increases estrogen and chronic inflammation. Conversely, regular exercise, about 7 hours a week, can actually slash that risk by up to 40%. So let's look at a very important kill switch: nutrition. That's right, your plate. It's a primary tool for hormone regulation. So diets that are heavy in red meat are consistently linked to higher risks, while a high intake of fruits, vegetables, these are actually protective. So we're seeing how specific nutrients like vitamin D, cruciferous vegetables like broccoli, these can help to detoxify the excess estrogen that fibroids crave. And then stress and sleep cycle. A lot of times we hear, oh, it's all in your head. No, chronic stress actually triggers cortisol. And this in turn can spike estrogen that feeds the fibroid growth. And when you have poor sleep pattern, that also impairs your endothelial function. So the very lining of our blood vessels can create a pro-inflammatory state that makes vascular conditions and fibroids worse. Let's also take a look at the environment, right? Now we're finding more and more that everyday chemicals like phthalates, BPA, those are found in plastics, personal care products, are considered endocrine disruptors, and they can actually reprogram uterine cells to form tumors. Okay, so in today's talk with Dr. Lee, we're going to talk about how to stop normalizing the pain and start listening to what these vascular signals are telling us about our long-term health. We're very fortunate to have Dr. Kevin Lee because he brings a rare dual perspective to the table. It not only merges medical precision, but it also combines it with a high-level understanding of how healthcare systems actually work. So Dr. Lee began his journey at Case Western Reserve University, where he didn't just study medicine. He earned an MBA from the Weatherhead School of Management. And this gives him a unique lens on how to build and scale innovative patient care models. And after earning his medical degree from Flinders School of Medicine in Australia and completing his specialized fellowship at Case Western University Hospitals, Dr. Lee became a true pioneer in the field of interventional cardiology. In 2010, he built the Interventional Oncology Program at University Hospital from the ground up, a program that now serves as a national blueprint for treating complex tumors through the vascular system. His expertise is so highly regarded that he was invited as an honorary member of the Einstein liver transplant team, collaborating on some of the most intricate vascular surgeries in modern medicine. He was also recognized as a top doctor for women's health by Philadelphia Magazine. Dr. Lee has transitioned these high-level surgical insights into the world of women's health. He is now a leading voice in uterine artery embolization, which treats fibroids not as an isolated growth, but as a condition deeply tied to a woman's systemic vascular health. So Dr. Lee has spent his career navigating the most complex highway systems of the human body. So Dr. Lee, we are so thrilled to have you here. Thank you so much for taking the time to be here to help us to understand what uterine fibroids are trying to tell us about our systemic health. But before we start, I'm going to invite you to tell us a little bit about yourself, what led you down this career path, and what specifically about uterine fibroids and vascular disease caught your attention.
Well, thank you so much for the fantastic introduction. I think that it's a pleasure to be here, and it's a pleasure to kind of talk about my passions and kind of what got me where I am and the opportunity to do what I do for patients and being in this such a gratifying field. So, I'm a interventional radiologist, and what we do is we are experts of using the most advanced imaging guidance techniques or, equipment. And we work within the blood vessels, and with these procedures, I always say are kind of like cutting edge without cutting. Okay, mm-hmm. So we use the most advanced equipment, and we treat patients where their recovery is minutes to hours and doesn't require major surgery, doesn't require anesthesia. And we're able to do these things in a community setting where we can bring our expertise and our experience into the community and make it accessible for our patients. Whatever we're doing, and work with the community of surrounding specialists, and it's been very, very, very gratifying for me. So when it comes to dealing with fibroids, when it comes to dealing with women's health, I noticed that, women in general are kind of suffer in silence, right? And so what I want to, what we strive to do is we want to make ourselves accessible and empathetic and available, and let these women know that there are people out there who have a passion to treat them, and to make sure that that they're well taken care of, and get and have treatment options available to them. Also too, I mean, we look at the person not just as the condition that they have, but we look at the person as a person, and we want we're here to promote overall health for women in the community.
Okay, that's nice. So, Dr. Lee, we are now seeing emerging research that shows both the uterine fibroids and vascular disease share inflammatory pathways. Can you help us understand how the systemic inflammation, rather than just local tissue problem, can actually be driving both conditions, and what this means for how we should be thinking about the treatment?
So I think that fibroids, what they are is they are benign tumors that grow within the uterus. And I think in the past, people as a medical community, that they were kind of disregarded. Okay, they're like, well, these are benign tumors. They're not going to kill you. But and then these other symptoms that you deal with, heavy bleeding, pelvic pain, well, that's just you just live with those, right? And so I think that, like, when you think about awareness, right? So a woman suffers in silence, and all these things are kind of like kind of disregarded or kind of poo-pooed, that there's not a whole lot of awareness about it, right? And so I think, well, so anyway, when it comes to fibroids, what they are is most of the pathology and most of the symptoms are related to the blood vessel side. What these fibroids are doing is they're basically taking the entire blood supply away from the uterus, and then during times of menstruation, they cause very heavy bleeding. That could lead to overall just poor health in a woman. Also, too, is they can be very painful because they're located within the muscle of the uterus, and they get squeezed during times of menstruation, which makes these very heavy, painful periods.
Yeah.
So anyway, so what we focus on is we kind of we're looking at a fibroid like it's a vascular issue. Okay, so I think that, when we think about fibroid health, and when we think about, cardiovascular health, I think when it first starts off is, everything is asymptomatic, right? Like, nobody experiences excess sugar in their blood. Nobody feels that they have excess, fat in their blood. Right. Nobody feels that they have high blood pressure, right? A lot of these things are asymptomatic until they kind of culminate, and they culminate into something where, it becomes like a disease manifestation. And I think that's kind of what fibroids are too. I would say right now, for every woman who has fibroids out there, like who knows she has fibroids and is having symptoms of fibroids, there's a possibility that there's 2 women out there who also have fibroids, but they just don't know they have them yet.
Sure.
So this is kind of like what, we're talking about systemic cardiovascular health, and we're talking about this, this gynecological condition that, where it's just like there's lifestyle risks, there's genetic risks, there's environmental risks, and people might not be aware of them, and they might not know that these things are contributing to these, disease manifestations until it may be too late or, kind of severe.
Yeah, I was recently listening to a podcast by a gynecologist and how she was also sharing how a woman can suspect that she has fibroids because, like you said, not everybody knows. Um,
Sure.
and even encourage them to ask their gynecologist to do an ultrasound because typically that's usually a low bar way of trying to identify the structure of the uterus, especially if the physician themselves is not very familiar with the fibroid realm
Mhm.
of things. It can be easily picked up with something as simple as doing an ultrasound. So, the American Heart Association actually recognizes the cardiovascular, kidney, metabolic syndrome like as an interconnected disease process. How do you see like uterine fibroids fitting into this framework, particularly given that metabolic syndrome increases peripheral artery disease risk and fibroids are influenced by similar metabolic disturbances?
So the cardiovascular kidney metabolic syndrome, it's a triad, okay? And it's, you got the cardiovascular system, and so we're thinking about, hypertension or heart disease, and then you got kind of kidney dysfunction, and that's, you start talking about chronic kidney disease and fluid retention, and then you got metabolic disorders that, with diabetes and insulin resistance, right? But anyway, when I talk about things as a triad, right? So, like, let's talk about cardiovascular health, right? So let's talk about health, right? So, you got the cardiovascular system, you got the renal system, the kidneys, and then you've got your endocrine, metabolic, systemic, system, right? And so when you talk about health, you got these three kind of pillars, right? And when one of them becomes like kind of overwhelmed and kind of starts like crumbling a little bit, right? It's almost like a tripod. Well, if one starts crumbling, the rest are going to kind of fall down too, right? So it's like, so if you have, a presence of, one condition that has, that's causing issues in one of these pillars, you're going to start raising the risks of developing, conditions in the other kind of pillars. They all kind of start knocking each other down.
Sure.
And it's all like a little bit of like they're just interconnected. I mean, this is a systemic process, right? And it's very similar with fibroids too, right? So I think that when we talk about health, the body has the ability to protect itself, with its immune system, with homeostasis or homeostatic mechanisms. That's like the body's balance, right? And you got genetic factors, you got, whatever, and then sometimes, some patients have good hardiness based on genetics or whatever. But when the environmental or lifestyle or, um, medical risks begin to start overwhelming the body's healing mechanisms and, hardiness, that's when things begin to kind of crumble. So when we're talking about, yeah, so anyway, I'm talking about this triad of the cardiovascular, kidney, metabolic syndrome. um and then I think you're leading into like how fibroids are, kind of are affected in a very similar way. Okay. So, you've got a benign tumor that's located within the uterus, right? And you're like, well, how is this going to, how are these fibroids going to be impacted, right? They're in my uterus. You know, they're a benign growth. What's my lifestyle going to do for these things, right? Um, but so, I think you brought up like diet, right? So if you have a diet that's like high in, let's say, processed foods or meat consumption, if there's like, when we're talking about animal protein, right? The animals, I mean, we're raising them for food, and they might be getting certain hormones and in their diet that it's just going to come into us, right? So that's going to lead to maybe excess estrogen and fibroids. I mean, they are estrogen receptive. And so if you're consuming something that has a lot of estrogen in it, it's going to lead to hormone imbalances and kind of start triggering growth of these fibroids. The other thing too is, I mean, if you're talking about diet, if you have high dietary fat, that's also going to lead to increased estrogen production in your system also, which is also feeding the fibroids and all these other things. And then a diet that's kind of high in animal protein and dietary fat can lead to inflammation of the blood vessels. And now you're talking about how it's impacting the cardiovascular system. Okay, when we think about inflammation, we think about how it's impacting the entire body. And I think you brought up before how the blood vessels are a complex network or highway of being affected by inflammation, because they're the first things to get it, but also they're transporting inflammation throughout the entire body, right? So inflammation is a bit of a problem, and I think that's why we really got to kind of focus on our diet. Other things, obesity, can also, I mean, your diet's going to affect your body composition, and your how much fat is circulating throughout your circulation. Obesity and then insulin resistance becomes an issue, and then you start to, now this goes back to that cardiovascular, kidney, metabolic triad that I was talking about. Things start getting kind of knocked down.
Okay.
So yeah.
So I think we can, just like you were talking about the triad, the uterine fibroids, specifically from a women's health perspective, is also giving us that signal, right? And I think,
Right.
like you were talking about the silent signal, like some women don't even know they have it, and they probably need to be paying more closer attention to their vascular health if they do discover that they indeed have it. And things like excessive menstrual bleed, where they're having to go through more than 4 pads, say, in an hour. I know some women that even wear diapers because of such heavy flow. I mean, all of that is not normal, and definitely should raise a red flag and have women take a closer look at their uterine health. So yeah, thanks for sharing about that tripod visual. It really helps to understand how so intricately connected everything is. And you mentioned a lot about diet and nutrition already.
Sure.
And, we are now seeing studies that suggest diets rich in fruits and vegetables can actually reduce fibroid risk. And then you had mentioned about the meat consumption, specifically looking at red meat seems to increase it. So from your clinical experience, how do you counsel patients about nutrition's role in managing both their fibroid symptoms and vascular health? And what evidence do you find most compelling?
Sure. I mean, I think that, you're bringing up kind of like imbalances of diet, right? So if you're talking about like, plant-based diet, I've had patients who've switched to plant-based diets, and they are quite, it kind of, it raises their mood, makes them feel healthier, changes their body composition. They kind of feel better about themselves, but more along kind of like the cellular level. You're talking about, like, if you're talking about plant-based diets or, things that high in, fruits and vegetables, there's more antioxidants, there's more nutrients that are, bioavailable. Those things are going to decrease inflammation and decrease, obesity, and also too, like, help with that kind of hormone regulation again. And then you also kind of allude to the fact that you've had women who go through a lot of, like, pads and stuff because they're bleeding so heavily, right? So the thing about heavy menstrual cycles are, they're the blood is like gas, right? It's like, if your blood levels are low because you're bleeding so heavily, I mean, there's not a whole lot of fuel in the tank, right? And so medically, we look at that, we call it anemia when there's like low blood counts. But what it is just like women have not a whole lot of gas in their tanks, right? And this could lead to stress. This could lead to sleep disturbances, all these different things, depressed mood. So when we're talking about stress, that's, there's a hormone called cortisol. And when you've got, sleep deprivation or sleep disturbances or stress, you have, hormone imbalances caused by excess cortisol. And that is another trigger for increased estrogen, which promotes, the progression of fibroid growth and proliferation.
Yeah. So do you actually counsel patients with any specific nutrition role in managing their fibroid symptoms?
Honestly, I mean, I think that as physicians, I, for myself, am not really trained in nutrition. So for me, a lot of it's anecdotal about like what works for patients and what I've seen work. But I've seen plant-based diets do very, very well for women with fibroids.
Okay. And then with the sleep deprivation, we now know, that it has been shown to impair the endothelial function and promote inflammation. And there's like a myriad of different mechanisms and how it does that. So when you yourself are evaluating patients with vascular conditions or fibroids, how do you assess sleep quality and what interventions have you found helpful for patients struggling with inadequate sleep?
I mean, you're right. I mean, there's sleep is kind of like a myriad of impacts. But the way that I kind of look at it is when someone is both stressed and sleep deprived, is how well is their immune system working, right? Mm-hmm. So that's one thing that we do take into consideration. So whenever we see patients, I mean, there's we look at things like sleep apnea. Those are risks with certain lifestyle choices. Obesity causes sleep apnea. Excessive alcohol intake causes sleep apnea. So we certainly look at our patients sleep patterns and stress patterns, and we have referrals for pulmonary to evaluate sleep apnea, and also to help with their sleep, we refer them out.
Okay. So it's mainly those who have an underlying pathological condition like sleep apnea. And a lot of times, I think a good majority, it's also just poor sleep hygiene, scrolling on electronics late at night, doing social media right before bedtime, not having a dark enough room. And sometimes it's just those simple things too, I think, make a difference for those who don't have a pathologic condition, but just
Sure.
are either just not familiar. And it's really stress, like you pointed out, stress and lack of sleep, they kind of go hand in hand. And then now we also know that chronic stress exposure is associated with impaired vascular endothelial function as an independent risk factor. So given that stress has been implicated in fibroid development, how do you help patients understand like the physiological, not just psychological impact of stress on their symptoms?
Well, I think that stress is something that is pretty hard to modify. Myself being a type A personality, it would be very my wife will be like, "Hey, why are you so stressed out? Just don't stress so much," right? So, that tells you two things. It's kind of hard to manage your own stress,
Yeah.
Also too, kind of tells me that I'm probably going to get fibroids pretty soon.
Right.
But I think that, so really what it comes to, I mean, this is, so before I was talking about the cardiovascular kidney metabolic triad, right? I think when, it could get knocked down, but, it could also get kind of built up, right? So if you start, healing one, it's going to start kind of picking up the others.
Mm-hmm.
And so it's kind of like, I think it's going to be very similar with patients' lifestyle, their stress, their stress modification, their sleep modification, looking at their environmental exposures and how to avoid certain things. And, and then, so I think that when, like, let's say we're looking at, this, now we have a table, right? We've got 4 things impacting cardiovascular and fibroid health. You've got diet, you've got the sleeping patterns, you have the stress management, and then you have the environmental exposure. So now we got a kind of a table, right? And, the 4 pillars could kind of knocked down, start pulling down the other ones, things like that, right? So, what can we do to kind of like block that, kind of stop the cycle, that, vicious downward spiral, right? And so, and I think that's like a multidisciplinary thing that we need to do, right? So, physical activity, right? If we're talking about exercise and, trying to like kind of, stop, in diet modification and all that, we're trying to block this downward spiral. So personally, I mean, I think that there's, that's where this multidisciplinary team really comes into play. I think that internal medicine doctors and primary care doctors, I mean, these men and women are the spearhead of really making an impact and helping patients navigate, their individual health issues. And promoting that. And I think, and it's always, it's always like really heartfelt to me when I have a primary care doc or internal medicine doctor, and we're really working together well to take care of a patient overall. Because, internal medicine doctors and PCPs, I mean, they really are patient advocates. And then getting patients out to a specialist when patients need us.
Yeah. And as a lifestyle boarded physician too, something about de-stressing, a lot of people think, it's a luxury. It's just a not must do. It's just, it'll be nice to do, But the truth is, just as important as eating your vegetables, just as important as your workouts, finding that one thing, even if it's like deep breathing, taking time for prayer and meditation, going for a nature walk, whatever it is to that specific individual. And I mean, as a physician, you yourself, probably you don't prioritize de-stressing because we were never trained to incorporate that into our lifestyles. And then we see physician burnout also at an all-time high. But de-stressing is such an important part of life. Taking pleasure in the simple things, whether it's spending time with your family, taking a soak in a tub. I mean, whatever it is that brings your stress level down is so important. And, you joked and you said, hey, I can actually get fibroids. I think for men, there is the cortisol steal issue, where the testosterone levels are so low. And it's like one of the major things that people are prescribing now is Viagra, right? Because it really causes sexual dysfunction. It causes so much in a man's health and even cardiovascular perspective, the sexual health. So stress is like a major destroyer. And I mean, I think for the longest time, everyone thought nutrition was a number one risk factor for diabetes and heart disease. And now it's stress because it's just our society, how we laud those people who are go, 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 go. And even from a social perspective, taking time to rest or taking time to have fun, we don't value that. And yet it's such an important part of who we are and the human experience even. So I totally agree with how much that is such an undervalued resource that we use in helping our patients and even promoting it when we talk to them. and just partnering with our primary care providers and also helping them to promote that messaging, I think is so important. And then coming to like that whole endocrine picture, right? So you did mention about the environmental exposure. So specifically things like the phthalates, the BPA, organophosphate esters, all of these have been linked also to increased fibroid risk. So, and it's a really tricky one because how can you and how do you personally discuss an environmental exposure with patients, and what practical steps can they take to reduce exposure because they're so ubiquitous in our current environment?
I mean, I think, that's that's a very nebulous gray area. Because what's we don't really know what we ourselves are exposed to, and what's really out there. I mean, it's hard to be really educated about what types of plastics are around, and I think and it's hard because a lot of these things are out of our control, right? I mean, you go to the supermarket and you buy non-GMO fruit, and you know what I mean? But if you're at a restaurant, I mean, I don't know if you're getting non-GMO, right? And also too, like what, the food that we eat, like what is our food consuming before we consume it, right? Like the pesticides, the pollutants. I mean, it's those types of things. I mean, it's how do you even tackle that when we don't have a whole lot of power or advocacy ourselves to influence any impact on ourselves or our communities. I mean, I'm not sure how we can do that as physicians or as medical practitioners.
Yeah, so I personally, and this is me just, for myself, I stick to glass or pure porcelain when it comes to kitchenware and things like that.
Mhm.
So if nothing else, I mean, and now people are becoming more aware, and you will find labels now, like you said, you go to a restaurant, you have no idea what you're serving you. And people can put labels on kitchenware and other things and say pure stoneware that's BPA free, phthalate free. Now, is that really true? We don't know, but at least you can have that knowledge to check for it. And the majority of us should encourage cooking your own food, eating out of your own kitchen. At the end of the day, that will serve you the best. And while we cannot live in a bubble, the more we increase our awareness, and when society starts buying certain types of products, we're indirectly forcing the industry to make products that people will buy. Because at the end of the day, it's money that drives the systems. So yeah, I think just at least improving that knowledge and letting our patients know is one of the ways. At least I try to do, and trying to increase that awareness. And you did bring up physical activity because, even just doing a research for this podcast, things that I came across, like approximately 7 or more hours a week reduces the fibroid risk by almost 40%. And so I don't know if you are counseling regarding physical activity, but if you are, I would love for you to share how do you encourage your patients to understand that movement benefits both vascular health and hormonal balance?
Sure, I think so. When it comes to like the patients that we see, we're kind of seeing them kind of nearing, so we're seeing them when they have a disease process, right?
Right.
And so for us, we're not, for us where we are, we're not on the preventative side.
Sure.
We're more on the kind of, what do we do now that, this patient's got, this going on. And so, we what we do is we refer out for kind of like supervised medical, physical training. And when we're doing that, that's when somebody has peripheral vascular disease or peripheral artery disease, and they have late manifestations. And so what we're trying to do is we're trying to help them develop new blood flow or additional blood flow to a certain area. it is helpful, but around that, but at this time, we're at this point intervening and fixing, the late manifestations of their blood vessel disease.
Yeah, and I don't think it's ever too late for people to incorporate those healthy, better lifestyle choices.
For sure.
Yeah, and even at this stage when you're seeing them, the fact that you're referring them for these supervised physical activity
Therapy.
programs,
Yeah.
it's because of the benefits that you're seeing. So that definitely should drive home the fact that they continue doing that. And it's not for the brief period of getting over that acute event. So I think there's still a lot of room and space for that conversation to happen, even at that acute stage, so people know that, hey, I can still do this. And then, right now we're in that stage in medical practice or training. Even when I speak to students or residents, we always talk about shared decision making, and how we're trying more not to do the top down type of intervention, but involving the patient and making it more patient centric with the shared decision making. And I know you're coming from a very different perspective because yours is more like the acute management stage. But are you able to structure conversations to help patients understand how to optimize lifestyle and medical management, and how, these kind of go hand in hand and they're appropriate for first steps versus just doing a procedural intervention, say like a uterine artery embolization? I mean, there are stages definitely when that's the right tool.
Right. I think, like I said, I was saying before, for us, we're kind of, as specialists, we're getting referred these patients when they've already have they're already symptomatic and they already have, just manifestations that are, after having the ability to be preventative. I think that's something that we could all strive for. Certainly, I think that when, you're enlightening me to the fact that, there's, we're trying to, kind of not just have people survive, but kind of thrive, right? And it's never too late.
Mm-hmm.
And I think so, I think this kind of goes back to kind of like what my philosophy is, right? So, when we're talking, when I talk to patients about, what their treatment options are, right? So when we're talking about fibroids, we're saying like, okay, well, here are some lifestyle things that you can do that can be helpful, that can improve your system, your symptoms, can improve your overall body health, and kind of, and these are the things that you can make a significant impact for yourself, right? And then after that, we've got kind of like medical therapies in there. Okay. So what we want to do is we want to push patients towards, what they can do lifestyle wise. Right. But if when it gets to the point where, they might be overwhelmed, either physiologically or socially or economically or environmentally, they start getting pushed down this pathway going towards medications, and then going procedures and then surgery. And where we try to fit in with our UFE procedure is our procedure is like effective and durable, right? So it's very efficacious, and the procedure, the results are great and long lasting. And so what we do from a procedure point of view is that, we're not like surgery where there's physical recovery of like maybe days, weeks, maybe months. Our patients physically recover from the procedure with maybe minutes or hours after the procedure. They're pretty much like, back to normal. Okay. And so, our procedures can be done, and they might not, after this procedure, they might not even need medications anymore. So it's kind of like, we're trying to like kind of bridge the gap of, approaching the minimally invasiveness of medications without needing the long-term usage of medications, which may have side effects or, complications.
Yeah, I think that's amazing. Because we do need those types of interventions. And I know for the longest time, people were just leaning towards hysterectomies. And now we know even if you were to preserve a woman's ovaries and remove the uterus, there are serious impacts down the road, whether it's mental health, cardiovascular risk. So having these minimally invasive procedures where you preserve the woman's uterine structure and her ovaries and overall, I think you're really benefiting their health. So it's really, great to hear that. And then maybe you can also share with us information about your practice so more physicians can refer to your practice and, a lot of patients can benefit from that type of minimally invasive procedures that can help them. So as far as the futures for integrative vascular care, how do you envision the role of, say, an interventional specialist like yourself evolving from primarily performing procedures to being part of a multidisciplinary team? I know you said you do work a lot with primary care physicians, and, just being able to address the root cause of vascular and hormonal conditions through lifestyle medicine, medical management, and then ultimately selective procedural interventions.
Yeah, I mean, establishing that multidisciplinary team is vital. And really what it is when you're in a hospital system, different specialties might be kind of politically divided, or they might just be siloed off from each other. So the thought process is like, well, hey, you've got all these physicians together. They're just going to perform integrative medicine. And then that's not the case, even in a hospital system with all these physicians being right next to each other. So being out in the community, really what we do is, we have our physician liaisons, and then we get out into the community as much as possible and, bring the awareness of, our model and what we're trying to do. And as far as integrative health, I mean, we were establishing that, throughout Atlanta, because that's where we're located. That's where Georgia Endovascular is located. We've got 3 facilities, throughout the, that are comprehensive, that are, in good locations throughout the city. But what we do is we have we have a net of where we send our liaisons, and also us as physicians and providers, we go on to the community too, and directly speak with patients and directly speak with, primary care doctors or whoever, whatever service line that we're addressing. But the main thing is kind of just to, is to remove those kind of political barriers and to stop all of us from working in silos. And I think the best thing is communication and really being accessible. I mean, what we want to do is we want to be of value, right? So from a non-vascular doctor, I mean, how are they going to know, what to do, what tests to order, what imaging to order, what the differential is. And so if patients are referred to us, like, we're kind of like an intelligent system where, the doctor might just be like, well, the patient's got, an issue with their foot or an issue with their leg. It's just something blood vessel related. We don't know what it is. And we're like, well, of course. I mean, how are you? So send to us. We have our imaging on site. We have our specialists on site, and we're going to evaluate the patient. And then we're going to, if we're going to give you something, useful, we're not just going to send the patient back and say, oh, it's not a vein problem. We'll be like, oh, it might be an artery thing, it might be a podiatry thing, it might be, this patient needs, medical management, or they need a referral to this. And so, we're helpful and collaborative. And that's what we're doing, and we're effectively doing that right now.
Yeah. And I can also see in the future this being like a two-way street, where you can also refer to, say, a nutritionist, exercise therapist, and help people with the root cause type of thing. Because I'm sure a lot of times you get these referrals and these patients have not been properly evaluated from a lifestyle perspective. And I think it's so worth exploring because we're really giving our patients so much more when we are empowering them to, take control. And I know not everybody is receptive to that information. Unfortunately, most people just prefer the pill or the surgery rather than take the responsibility to do what's good for them. But I think we should still try and open that door for conversation. But it's been great, Dr. Lee.
Yeah, thank you so much.
So much great information with us. Thank you. And then is there anything else you'd like to share before we conclude?
I was actually just wondering, what resources are there out there for us,
Yeah.
the typical, physician, what resources are out there for us where you say, okay, this is where to go if you're looking for a good nutritionist. This is where, is where to go if you're looking for someone to help with, exercise therapy and stress reduction. And
I would start with the American College of Lifestyle Medicine website. They have a full resource as far as who are there certified, whether it's a nutritionist, exercise therapist, because it is a very mixed community of people. Sure. So I think that website is a very good resource for you. And even your primary care providers, because a lot of them, at least a good majority of them, are aware, because if you go to a primary care practice, they don't have the time to sit and talk about lifestyle interventions. But there are specific practices that network or even refer to specific nutritionists, specific exercise therapists that really hone in on this lifestyle aspect. Because sometimes with just a regular nutritionist or regular exercise therapist, they don't look at that holistic view. Your primary care providers for sure. But as far as from a national perspective, I would say the American College of Lifestyle Medicine is what I typically use as a great resource. So specifically looking at Atlanta and who are the board certified lifestyle medicine nutritionists or exercise therapists that you can partner with. And a lot of times even psychologists play a huge role. Because even with the depression and anxiety piece of things, if that's not addressed, people are not motivated to do anything,
Yeah.
So we really have to have that holistic perspective. And even social workers are huge because they go into the person's life and see all the circumstances that they're dealing with and how to practically approach these different things. Because you can't tell a busy mom with 5 kids, hey, eat the fruits and vegetables. All she can do is order pizza, right? I think the interdisciplinary part is so crucial. And you really touched on a very important thing, which is the silo, because our whole training is we're just so internal focused. We don't see hey, I really lack in this area. How do I reach out to this person? And like you were saying, not everybody knows anything about vascular health, but you do. Yes. And your team does. And so just making yourself there available for physicians to reach out to you when they know, hey, we know that this person doesn't have a pedal pulse. Who do I send them to? Can send to you, figure out what's going on. And, and then ultimately you're like, oh yeah, not only is his pedal pulse absent, but he has really bad atherosclerosis. Send them to the vascular heart surgeon maybe down the road. But I think, to answer your question, I would start with the American College of Lifestyle Medicine website. It's a good place to start.
Well, that's fantastic. Thank you for that.
Yeah, you're very welcome, Dr. Lee. And again, thank you for your time, and we hope to see you in future episodes, yeah?
All right. Thank you so much. Appreciate the invitation.
Of course.